Okay. Okay. So I'm gonna start. I'm gonna start. If that's all right. Okay.
Mhm.
Okay. So is it true that dry eye symptoms seem to be more severe in the winter than in the warmer spring and summer months?
Dry eye is in fact worse in the winter versus spring or summer for most patients, mostly because in the wintertime, there is colder air and the air has less humidity. Most of us are using some type of heating system, which also reduces the humidity within our homes. And that causes our skin to get dry, our eyes to get dry, our lips to get chapped, due to the fact that moisture is being pulled out of our eyes and we feel symptoms worse at that time.
Okay. Well, I mean, often I suffer from dry eyes. I'm just wondering when, like, I should go in to see the optometrist for dry eye symptoms, and when is it enough for, like, let's say, me to take care of this problem by myself?
So if you're having mild dry eye symptoms and you're using an artificial teardrop that is over the counter and you're using it 2 to 3 times a day and that's relieving your symptoms and your symptoms are intermittent, then you might be able to self-treat and mention it at your annual eye exam and discuss it with your eye doctor. If, however, you're using these over-the-counter remedies 3 to 4 times a day consistently, your symptoms are not improving, your vision is fluctuating, you're blinking to make things clear, or if you have any other symptoms like dry mouth or joint aches, um, that are also problematic, it's definitely time to make an appointment and have a thorough dry eye examination.
Okay. Okay. And speaking of, let's say, over the counter, are there like common medications that may cause dry eye symptoms?
There are many medications that can affect dry eye. Some of them are antidepressant medications, blood pressure medications, some medications that we take to reduce stomach acids. Those can all affect the ocular surface and create dry eye.
Okay. And I also heard that, sometimes like eye surgeries, LASIK could maybe affect or cause dry eyes. Is that true?
There is a strong association between eye surgeries and dry eye. The more that we learn about dry eye, the more we realize that any eye surgery that involves making an incision in the cornea can create dry eye symptoms. And that's because the nerves, the corneal nerves, are being affected, and we're reducing biofeedback to our lacrimal gland. So for any eye disease, so that is LASIK, that could be glaucoma, cataract, and even retinal surgeries can affect dry eye symptoms.
Okay. Okay. But are some people more prone to having dry eyes than others? Does it affect women more than men, older people more than younger people? What is that like?
So anyone can be susceptible to dry eye. Women do tend to have a higher prevalence of dry eye. Perimenopausal and postmenopausal women tend to have more dry eye. Older patients, as we get older, we produce less tears, so they will have more dry eye symptoms. People who are on computer screens a lot during the day, screens, tablets, phones, tend to have more dry eye as well. Um, and we also tend to see this in patients who have rosacea. Rosacea is also contributes to their dry eye symptoms.
Okay. All right. Well, let's say somebody who's pregnant could they experience dry eye symptoms more so, or is that just a myth?
Sex hormones are really strongly associated with dry eye symptoms. So it is likely that the change in hormone levels can affect tear film quality, quantity, and it can also affect your cornea. So it is likely that they could have some changes in their dry eye symptoms as well as their vision.
Got it. Okay. Okay. And just switching gears a little, let's say somebody has overly watery eyes. I've heard I've heard it been called dry eyes, but is it dry eye? What exactly is that?
There's a lot of reasons for someone to have watery eyes. Dryness is one of them. In some people, your body will respond by trying to fix the problem, and they create more tears in response to that dry surface. Of course, if you have watery eyes, it's best to get checked. Let your eye doctor examine you because it could be allergy, it could be a lid problem, or there could be something else going on. So there are other reasons for it, but there is a definite association with dry eye disease.
Okay, so it's almost a very like counterintuitive way of looking at dry eyes if somebody's
Absolutely,
eyes are
yes.
water. Okay, uh, and let and what exactly is the examination like to determine whether or not someone, let's say, such as myself, is suffering from dry eyes?
When a patient comes to my office for a dry eye evaluation, they'll fill out some specific forms to tell us about their symptoms. We will take images of their lids and lashes, the surface of the eye. We will do infrared imaging of their meibomian glands. We'll measure tear film. We use different colored dyes to assess the surface to look for damaged or dying cells. We look for friction when there's blinking. We look at the cornea to see if there's any corneal damage. We try and assess for corneal nerve damage that could be affecting biofeedback. So it is a very detailed examination. We also take a look at what medications, what is their diet like, their sleep habits, and what other treatments that they've tried, and try and get a treatment plan in place. So the first visit is usually a pretty long visit with a lot of detail and a lot of testing that most patients have not yet had.
Okay. Okay. And if you don't mind, if you can go into detail, what are some of the typical treatments that you use to help people suffering from dry eyes?
So we look at the patient, the type of dry eye that they have. Most people have some combination of dry eye, whether it is what's called aqueous deficient, lipid deficient, or mucin-based issue. And we'll prescribe medications if it's appropriate. So there are Restasis, Xiidra, Cequa, and now there's Tyrvaya, which is a nasal spray that are used to treat by prescription various forms of dry eye. We'll take a look as whether or not artificial tears are needed, if there's an ointment that might be needed. We'll take a look at the lid and lash line. So if there's any evidence of ocular rosacea or blepharitis or Demodex, we need to treat that as well. So those treatments will be things like lid hygiene, blue light mask therapy actually is really great for keeping the lids clean, getting rid of Demodex, in addition with a Blefx or a zest-based treatment. Kind of like going to the dentist and having a cleaning where we clean all of that debris off of the lid and get the biofilm that develops off of the lid margin. Then we can take a look at if they are more severe, needing autologous serum tears, Regenerize, which is a biologic. If there's nerve damage, we'll look at something like Procara, which is an amniotic membrane treatment to help heal the cornea and increase limbal stem cells to help heal any nerve or dead corneal tissue. We'll also discuss if they are a candidate for intense pulse light therapy, if they need thermal heat or expression like EyeCare. And if those might be out of their budget, we do offer low-level light therapy, which uses a red mask, red light combined with heat, which also allows us to express those glands. If patients have meibomian gland dysfunction, which are the glands in the lids that don't express oils, is what's happening there. We need to get the clogged oils out of the glands. And the only way to really do that as of right now is to use a heat expression type of a therapy. And light therapy actually helps those glands get better. Intense pulse light therapy being the gold standard of treatment in that area.
Got it. Okay. Speaking of IPL, again, if you can go into more detail, what exactly is it? I've heard a lot about it. What's the success rate? If you could just go into it more.
So intense pulse light therapy, or IPL, is exactly what it sounds. It is an intensely bright light, and it is applied to the skin of the face and to the eyelids. So it started out as a cosmetic treatment. It was used in dermatology to help build collagen, to decrease redness, improve fine lines, and decrease brown spots on the skin. And what was found was those patients who were having these cosmetic procedures, their dry eye improved. So intense pulse light therapy, we apply all across the face, the front of the face, and there are different protocols, which can include the eyelid, and I believe it was Dr. Art Epstein that included forehead and chin as well. So there's different protocols on where to apply this light. The end result is that it improves the mitochondrial function of those meibomian glands. It decreases inflammation. It will help kill any bacteria or demodex that are present on the skin as well. And it allows the glands to start working better. So patients will feel symptomatic improvement. Now, the first time you have intense pulse light therapy, you do have to go through a series of treatments. You need a minimum of 4. Most patients can go with 4 treatments spaced about 4 weeks apart. And after the 4th treatment, the success rate is about 85 to 90% improvement in symptoms across the board. Some patients may not experience symptom relief after just 1 treatment. The treatments do build upon each other, so you do need to complete that series of treatments to get the full effect of that therapy. Now, once you have all 4 treatments and you need maintenance, you may only need 1 treatment at a time. And that could happen 6 months or 1 year later, depending on how well you do with the rest of the therapy at home. The nice thing about intense pulse light therapy is that, it is applied to your skin. Patients do get a rejuvenating effect. So they do get that improvement in collagen. There is some reduction in fine lines. So they look better. The redness in their eyes starts to improve. So they start to feel better. And, having that a little bit of aesthetic benefit makes people feel a little bit better about themselves as they're going through therapy.
Okay. And I also heard scleral lenses can help for dry eyes. How exactly does that work? I know scleral lenses work for keratoconus, but how exactly does it help dry eyes?
So a scleral lens is a special custom contact lens, and it looks like a bowl, and that bowl is filled with a sterile saline. So the eye is bathed in the sterile saline all day long while you're wearing the lens. So the cornea is kept moist, which is what helps their dry eye symptoms. Now, for really severe cases of dry eye, they can put some artificial tear in there. We can use a special form of saline with electrolytes to help them. There are patients who need to put their serum tears in the bowl to help nourish that cornea and the corneal nerves. But because the cornea is being bathed in that solution all day long, it does keep them more comfortable. The only downside to scleral lenses is patients who have meibomian gland dysfunction. If your glands on the lids aren't producing or secreting oils, the front surface of the lens does not wet well and you get friction. So it's really important to make sure that you also look at that piece of it and treat that so that they can tolerate those scleral lenses. Patients that have aqueous deficient dry eye who might have something like Sjogren's syndrome or rheumatological disease where they're not producing enough tears do really well with scleral lens therapy.
Okay. And And I guess just the last question for now is, do you have any recommendations for people to help them like avoid or mitigate some dry eye issues?
So I usually tell my patients when I notice that they are starting to have some physical changes, I discuss screen time, which tends to be the biggest issue nowadays, especially post-pandemic. We're seeing significant changes to our meibomian glands, even in children. And the reason for that is we're looking at screens many hours a day. When we look at screens, we don't blink. And because we're not blinking properly, we're not giving any biofeedback to those glands. We're also not stimulating the glands with the blink reflex to secrete their substances. So it's important to do blinking exercises. So I'll review to do blinking exercises about every 30 minutes when you're on a screen. Also, it's super important to stay properly hydrated. If you're not drinking enough water, then you're not going to be able to produce enough tears. So on average, 64 ounces of water per day, more depending upon your activity level. I ask patients often to consider doing a warm compress, especially if you're a heavy computer user. So 10 minutes of heat once a day. Taking a good omega-3 supplement. So omega-3 is found in our tears. It is naturally anti-inflammatory. So, and most of us have an imbalance of omega-6 from processed foods to natural omega-3s. So most of us can use some omega-3 to help improve the quality of the oil that's in our tears and decrease inflammation. And then managing stress, anxiety, and getting good sleep. So one of the other problems that people have with screen time is that blue light disrupts our sleep cycle. And if we're not getting good sleep and good rest, we're also not going to produce good tears. So getting a good night's rest is important, being able to fall asleep, stay asleep, and then again, managing our stress and anxiety levels during the day also plays a role in the quality of tears that we produce.
Got it. Okay. Okay. This is very, very good. We got some really, really good content off of this. And next time around, I'm going to ask you more questions. But I think
Okay.
this is good. This is good for now because I'm going to go into depth on like the the tear serum and all and BlephX. That'll be the next time because there's a lot of misconceptions when it comes to BlephX.
Mhm.